is really, really nice here in Las Cruces, and just enjoying some of that cool freshness this morning. It's where I usually record these little podcasts or whatever you call them, the live events, and I do that before I start seeing patients in the morning on Tuesday mornings. And some people pop in and listen to them. Some people don't, but I know a lot of people watch the recording. So I want to do a shout out and thank you all for watching these recordings. I know they're not really professionally done by any means, and they're not fancy or anything like that. But I am humbled that people are actually tuning in and listening and commenting. Now, I do want to throw this out there. If you are watching a recording of this, please in the comments just give me a time that works maybe better, a better time, and maybe we can fit that into our schedule rather than doing it at 8:30 in the mornings. On Tuesdays, maybe we can switch it up and do a live event where people are able to participate and maybe ask questions in the chats and things like that. So I think that might be something that we can consider doing. So, but thank you for watching and thank you for participating. This is fantastic. Today, I'd like to talk a little bit about. Well, I always talk about moms and the things that go through moms, and I do want to just kind of give a little shout out to moms. I'm actually really excited because this weekend I'm going to visit my grandmother, who is turning 95. And we're going up to visit her and celebrate her 95th birthday. So I'm very excited for that. But moms are incredible. They do so much for us. I think that the world goes around because of moms. They just do so much, and a lot of times they do it with pain and chronic pain, and they kind of hide it. They do a really good job of just pushing through it and getting things done, getting what needs to be done, getting it done, and they tend to neglect themselves a little bit. Well, I don't think that there's any need to do that any longer. We have so much in the world now that we can do. Um, we can find the underlying cause of pain and we can treat it and we can get rid of it so that moms can do everything that they normally do, take care of their kids, work the house, spend time with their loved ones without pain. And that's one of the things that I really enjoy doing in my clinic here is I try to get to the underlying cause of the pain, not just treat it with not just treat the symptoms. I treat people. And I try not to, symptoms are important, but they lead us to the underlying cause. So it's really important that we don't just stop at symptoms because symptoms can be eliminated by easy things, a chiropractic adjustment, some medication, maybe some physical therapy, stretching, massage therapy that can temporarily ease the pain. But is it really getting to the underlying cause? Sometimes it is, a lot of times it's not. And so one of the underlying causes of pain are hormones. Now, do hormones really cause the pain? I know that's kind of it's a little bit misleading, but I want to clear that up. Hormones don't necessarily cause pain. However, an imbalance in hormones that can create problems, that can cause pain, that can amplify pain. Now, I'm a chiropractor. I see and I'm a certified functional medicine specialist too, but I'm a chiropractor. And so I see a lot of musculoskeletal pain symptoms. A lot of people come in with joint pain, back pain, neck pain, headaches, migraines, all of that sort of thing. And chiropractic historically does fairly well with those. In the past, I've had, 60, 70%, success with those. And there's always those extra few that I can't help with my chiropractic adjustments until I started looking into hormone testing and balancing hormones. And I found that when we look at those hormones and balance the hormones, we get much better success rates. And so I've started implementing that into my practice. And so when someone comes in, yeah, we'll look at the muscles, we'll look at the spine, we'll look at the joints, we'll look at the nerves, we'll do x-rays, but we're also going to do I also have been doing more lab testing to identify any hormonal imbalances. And boy, that has really made a huge difference because now we're really getting to the underlying cause rather than just treating the symptoms. And so if you are a mother and you have low back pain that is, or any sort of pain, joint pain, fibromyalgia, chronic fatigue, anything like that, that's actually starting to affect the way you do what you do in taking care of the household, taking care of the kids. Maybe you're working full time in addition to doing all of that. Um, and if you need a little extra help or you're not quite sure where to turn, I think we've got some answers that no one else that I know of in this area is doing. And so I really encourage you to give us a call, find us online, um, make an appointment. Shoot, even if you're not ready to commit to a full exam and treatment program, give us a call for a discovery call, and I'll do a free discovery call with you and answer maybe any questions that you might have. It's a free 10-minute discovery call, and I'll ask you some questions about your health and some of your goals, and see if we're a good fit for each other. And if we are, great, we welcome you into the office and see if we can't get to the underlying cause of your problems, your pain symptoms, anything that's stopping you from doing what you do. And again, what you do, if you're a mother, what you do is absolutely amazing. It truly is. And so, yes, I'm here to help. I love helping moms. I love seeing that turnaround, where someone comes in and they're starting, when they first come in, they tell me that they can't sit and bathe their kids, or they can't sit for very long and help kids with their homework. They can't sit and read the bedtime stories anymore because they just want to go to bed because they're so tired and sore, and they're just not feeling good. And so they're a lot of moms say that they feel like they're missing out. And so to see that turnaround, to see where all of a sudden, within 60 days or so, they're bathing their kids, they're picking them up, they're playing with them, they're taking that little extra 10-15 minutes at night to read them stories, and just spending a little bit more time with their loved ones, without worrying about pain or having to feel like they want to go lay down. So this is a beautiful thing, that beautiful transition that we're seeing, and I love seeing that. So I hope that everyone is happy and healthy. But if you're not, please give me a call and let us see if we can't help you get there. A lot of these hormones can amplify the pain symptoms, and they can cause they can they can make disc herniation worse, for example. They can cause neuropathies like carpal tunnel, plantar fasciitis, any sort of nerve numbness, tingling sort of things. And we can address all of that by looking at the hormones. It's a simple blood test. It takes about a week to get that analyzed, but once you get your blood drawn and you get those test results back, we have a lot of clues as to what's going on. Now, the downside is most of these aren't covered by insurance, so your family doctor isn't going to check for these because they're too expensive. But I work with a discount lab, and so we can get around that, and it's a beautiful thing. So, and how do we treat it? Well, we look at what hormones are imbalanced and what nutrients are missing from the diet, and then we correct that. And it's really quite that's almost that simple. Of course, we've been doing this for a long time, and we've seen some great results. And so we can't wait to help you out as well. So again, thank you so much for watching this video. Again, I know it's not really all that professional, but kudos to all you moms out there. And thank you so much for watching. Hope to see you soon. And good luck with everything. Have a great day. Thanks for watching, and make sure you comment or like or whatever, with this video. Share it with someone you think that will benefit from it. And if there's a certain time that would work better for you, put it in the chat. Even if you're watching a recording, I still look at the comments a long time after I do these recordings. So give us a chat and give us a comment and let us know what you think and if there's a better time to do this. Okay, so thank you so much. Have a great day.